Yeah, yeah, I see.
On affirmative, we strongly believe in moving towards a path of social acceptance as opposed to forcing people into mainstream society. Because what a particular target of this policy are severely mentally ill individuals. We're not talking about individuals with mild OCD because let's face it, we're all a little bit crazy. On study proposition, we would characterize severely mentally ill individuals as individuals who have severe mental instability. These are potentially developmental diseases like schizophrenia and severely bipolar people. Distinguishing the two forms of illness with regard to management. Like we think it's easier to manage things like say mild OCD as opposed to be severely or say severely bipolar. Say these things usually require corrective treatments that have severe applications that eventually alter their composition, their fundamental identity. So what do we support from side affirmative? We think that the best response is management. Like say for example, caregivers will help them manage this community integration when they're not a threat to society. And thirdly, how drugs that we otherwise give to healthy people to help them maintain that form of living. No, thank you. We think that in response to how, say, we allow people not to be threats to society and be harms to ourselves, which is a fundamental state role, the same application happens here. We think the framing should happen in terms of greater social acceptance as opposed to forcing people to integrate into society. But before I proceed, my instructive, yes.
Corrective management under status quo is medication and the kind of management you have that you're proposing. Can you tell us what we're supposed to defend, or are you expecting us to defend things like shock therapy for individuals with mental illness?
Well, actually, that is the right characterization. Shock therapy. They're really a false characterization in terms of, say, what do you think severe treatment is, because those are things like shock therapy, giving them so much drugs that they're unable to handle themselves, and their fundamental identities are different. Like in some cases, they're not able to stand properly. I make a distinction in my argumentation. But firstly, let's look at the principal argument about how this is an unjust violation of rights. We understand that to some extent we are making decisions on their behalf, but these decisions are inherently protected. No, thank you. Because what happens is that these drugs that people give them allow them to stop them from becoming a threat to others. Now, what's the difference from these corrective forms of treatment? When you talk about corrective forms of treatments, these are things that are very invasive. Electrocution, heavy medication. In most cases, these individuals are no longer able, are incredibly incoherent, end up crying or locked up. But the thing is, our mitigation is much better because these are things, because say for example, when they become a threat to society, when they become a threat, you automatically just let it happen. You provide caregivers to wait until they're stable and able to talk to people anymore. Now, what's wrong? No, thank you, sir. Well, now let's look at the idea of this invasive treatments. We think that the difference with regards to electrocution, or say shock therapy is that it makes it harder for these people, like in terms of the pain they feel. Yes. More than that, we think that if you look at the history of these corrective treatments, like say the first person who was subjected to shock therapy ended up killing himself. So we think to some extent, or subjected to this invasive and corrective forms of therapy, were ended up killing himself. So what we think is the consent is altered to some extent. Like you can never really assess if these people are want to engage in the treatment. But more than that, if the consent isn't altered, we think that pain is a subject, is a standard that can be applied to all. But the difference is the thresholds of pain are different per person. So you never have rational and accurate measures to say that one person is feeling more pain than the other. And anything that's much different as opposed to people with severe mental condition, severe mental diseases. Because now they're not able to say, doctor, I feel pain, will you please stop the treatment? Because what happens is you're going to directly you're going to continue the treatment, and that's going to cause them pain. We think that this form of analysis is important to take into account. Yes, sir.
At this point in time in debate, there is no principle clash from government, because if you say you want them in their natural state and you don't want them to change and you want society to accept them, why are you prescribing drugs or want them to go to medical to change how they feel?
But sir, the drugs we talk about are drugs that they would give to otherwise normal people as well. These are not drugs with magical powers, but otherwise the same things you would give a healthy person to stay healthy, or a normal person or person that you would see as normal to stay healthy. So we think that's a principal clash within the debate. Now, more than that, we feel that if you are unable to assess the idea of pain and how a particular person feels, we think you're eventually making that person's life even worse. Because if you're unable to accurately gauge the amount of pain a person feels, and you can see them literally crying while they're being subjected to the treatments, then we think they were much better off before that. Because there aren't any clear indicators of pain. But more than that, let's talk about my second argument, about how the presence of corrective options erodes choice and undermines support structures. In the case that science says there is a cure, we're likely to think everyone is going to buy, or society is going to think that, yay, there's an easy way out, there's a cop out. But more than that, we feel that there are some individuals or some parents who are okay with their children or being in this natural state. More than that, they also don't want their children to experience pain, and they're okay with the current management processes, and they're afraid for these children to undergo these procedures. We think that political clamor and funding for these types of individuals who are okay with their kids being in this natural or severely developed state will sway away, because now people will say they could have opted out and did something and could have done easy and could have been correctively treated. We think this reduces the incentive to help this particular sector. More than that, we think the blame game will happen. Like, it's more likely for parents to either just blame their children or blame themselves. So most likely, the ability to manage these kids is also inherently affected. Secondly, we think that in certain cases, when individuals do engage in the treatment and the clear individuals feel that they're getting better, they're going to engage in a heavier dose, and we think this is going to alter their fundamental composition, like the way they engage with people, and this will further hurt their identities. For all those reasons, we're more than proud to propose.
Thank you for speaking by the leader of opposition.
Ladies and gentlemen, if government expects us to stand up here and defend electroshock therapy, lobotomies for mentally ill patients, and to torture them in mentally ill asylums, we think they have a really big problem as to what we think debates are. Ladies and gentlemen, what do we support on the side of opposition? Status quo defines that corrective treatment of individuals with mental illness as having medication, as Sanjay told you, to treat individuals who are violent, who are individuals who may be angry or autistic individuals that may not be able to manage their emotions very well, or even to the extent of correctional treatment for prisoners that may not be able to have any sort of ability to control how their actions pan out. We are very happy to alter how they perceive things or alter the way they act in society today. We thought under the side of government, they could have done a little bit more in terms of telling us how the natural state apparently of a person and the acceptance of that natural state of how this person that was born in the state should be accepted that way was possibly going to be formed, considering that they will form all the kinds of correctional management treatments that happen under this law as well. So you tell me, if an individual has schizophrenia, because as Sanjay told you, we're talking about the harsh cases of people who are schizophrenic and cannot manage their emotions. And they really are angry and violent and you want them in their natural state, how are they going to be accepted in society when every single time society looks at these individuals and once they have beaten up someone because they cannot manage their emotions, how is the acceptance going to be formed then? We need some answers from side government. Maybe the better two speakers from government can provide them. So let's go on to a few rebuttals before my substantive material. Number one, let's make it very clear. There was a clear principal concession from government that they told us that there was not a natural state under that side of the house. But secondly, ladies and gentlemen, they talk about the representation of the patient, how the patients oftentimes aren't able to say no when doctors want to prescribe more and more things upon them, ladies and gentlemen. Oftentimes, number one, just to engage with them on their characterization, we have many sorts of representation. For example, the kind of weekly or even bi-weekly visits that you have by parents when it comes to minor people under the age of 21. The fact that individuals that are under the age of 21 in the United States of America get not only free psychotherapeutic healthcare, but also get free legal representation in terms of suing the hospital that they allege has mistreated them. Even to the extent that doctors want to abuse their positions and even want to prescribe drugs to the extent that it may seem abusive. A very large portion of the legal system today weighs very heavily upon the individual that seems to be disadvantaged in that particular regard. For example, we give greater leeway in terms of legal system towards individuals that may be incapacitated, individuals with mental illness, or even to some extent children. So in those circumstances, we think that representation by the patient happens very well under the side of opposition. Secondly, they talk to you about the blame game. Apparently, parents will now blame kids if they go through shock therapy. Till keeping up, we don't support that at all. But examining the analysis in isolation, ladies and gentlemen, how does allowing an individual to go through the kind of treatment that corrects an individual's behavior as well and places an onus upon the child to change his behavior as well, going to shift any sort of blaming game between the parent and the child's dynamic? Because if the parent is an individual that already blames the child in this instance in regards to why aren't you getting better or why isn't the treatment working, then the exact same measure that they're proposing will result in the same thing of a blame game by the parents towards their kids. We don't think it make much of a difference. In fact, he was very flippant about it in his last 50 seconds of his speech. Before I go to my substantive material, save your kids.
We do not want to change the identity of this person. We just want to manage it. Are you expecting government to defend a mentally insane person to roam freely without any form of restraint?
No, and now I'm going to tell you what you were supposed to defend in this debate. Number one, we never expected government to defend psychos to go out into public and to go and kill people, but at the very least we expected you to take up the burden of having individuals in society, the autistic kid that goes to school, to not go for correctional treatment because of the thing that they take that school should accept it as because they are, as opposed to having him correct himself for society. Those are kind of mild cases that Sanjay effectively threw out of this debate, which where most of this moderate characterization of the debate happens here, ladies and gentlemen. We are playing against that side of the debate. Let's go on to the real debate, ladies and gentlemen. Firstly, we told you already what we support under status quo, and we told you that we're not very much for the extreme measures under the side of government. But, ladies and gentlemen, the side of opposition is willing to tell you that it provides a strong support and coping mechanism for individuals in society. Though sometimes this may sound like much of the analysis that came up from Sanjeev on the side of opposition, that isn't exactly our fault from my speech, right? Because number one, you have to acknowledge that individuals that face mental disabilities in society face a myriad of difficulties in terms of how they can perceive themselves in society. An individual or child who is autistic in school, ladies and gentlemen, oftentimes falls into depression because he is unable to cognitively process why is it that the kid next door is bullying me at school every single day. Oftentimes kids with autism commit suicide because they don't have the emotional capacity or the psychological capacity to deal with that particular situation, ladies and gentlemen. Even in the most mildest cases of autism, others are giving them the benefit of the doubt. Oftentimes, kids are internally torn in between wanting to formulate their own identity in society and asking themselves and being taught as to why is it that I'm not normal, why isn't there anyone helping me dealing with this particular situation. So even in the most mildest cases, kids are still taught and want help from the state, ladies and gentlemen. If you tell me that you want them in their natural state, oftentimes some kids of varying degrees of difficulty may be able to cope with the kind of difficulties you have in schools, ladies and gentlemen. But for kids that choose and ask their parents every single day, why can't I have help? Why is it that you can't tell me that and give me medication to deal with my anger? Why is it that even though my anger isn't to the extent of killing someone, my anger is pretty bad as well as to why I'm angry at myself and I may feel depressed in terms of wanting to kill myself, ladies and gentlemen? Why is it that family treatment isn't allowed under the side of a government, ladies and gentlemen? The argument in this debate about people being in their natural state is bereft of any analysis as to whether or not society should have sympathy for these individuals. Because we'll have to acknowledge at the end of this debate, the capabilities of an individual with mental illness is different from an individual who does not, ladies and gentlemen. And allowing them to go through a corrective treatment or corrective mechanisms, ladies and gentlemen, at least provide society with some degree of ability to sympathize with them, because they can see that we have a trajectory of improvement, that there is a benchmark to measure whether or not these individuals will be functional in society. Conversely, under that side of the house, there is an unfair expectation on individuals that have mental illness to act in their natural state, to act like everyone else when they are fundamentally unable to be this. And that's the unfair expectation placed on individuals with mental illness when you can't absolutely deal with the situation at hand. At the start of this debate, you have to make things one thing clear. The government has a lot of work cut out for them in terms of correcting that case from second speaker. But secondly, this natural state argument does not fly. We are very proud of it.
Thank the speaker for his speech. Invite the GPM.
Ladies and gentlemen, the speaker before me conveniently misrepresented our case. I am sure many of you have heard of the motion before. This House supports the management and adaptation to climate change versus complete reversal of climate change. That's what we're doing here. We say we want to manage it. That doesn't mean you don't do anything when you are managing something, right? But you're not fundamentally changing it. Sanj was very clear. He said, we are giving them medicines we will give ordinary people. When I'm so stressed and hyperactive and thinking about a lot of things, I sometimes pop a sleeping pill, so I will sleep, so I will calm down. There are mild antidepressants you can give people. Those are things you give normal human beings. Under the logical extreme of their case, right, they want us to let these people run amok. Or if they are okay with us, sedating them for a while until they are done with their violent fit, isolating them for a while until they are over the fit, that's not changing them, guys. We said the drugs are akin to the drugs you give normal human beings. But it was so convenient for them to paint us as soft, place it down, so they can run away from their burden. This is about management and support versus actually changing their identity, alright? Now, why is it that they need to defend some form of invasiveness on their side? Because they make it sound like it's so simple to treat these things. If it was so simple, then it won't be mentally ill, right? Then it will be just, another usual disorder that you can treat. You're dealing with patients who sometimes resist treatment. What are you going to do under your model? You're going to have to strap them. You're going to have to restrain them before you administer the drugs. These drugs are not light drugs that have no side effects. That's what he's lying to you about. Please sit down. These drugs are things that make you really tired, make you really sleepy, make you feel some pain, make you feel like you're not yourself, introduce massive discomfort, dizziness, nausea, hallucinations. They interfere with your biochemistry. They result in hormonal fluctuations. Sometimes they result into more fits of rage or greater depression. If it was so easy, again, I want to underscore this. If it was so easy to treat it, we won't be having this debate because it won't be contentious. Even on the level of heavy medications, they're not defending their burden. Sounds very clear. That's all we don't want. So fine, you don't want to defend like electroshocks. You're gonna have to defend strapping people. You're gonna have to defend detaining people so you can administer these drugs when they finally act out. But you ran away from that. All right, before going, yeah.
Look, they're looking for the cure for maybe diseases like Down syndrome doesn't have to necessarily be mutually exclusive from the management of the symptoms of that particular disease.
Yeah.
So can you tell us why it's mutually exclusive?
No, it is, because we're stopping at management. We don't want people to look for the cure anymore. That's why it's mutually exclusive. You have to defend the other half of that, right? Of curing it. Now, let's talk about which policy results in more social acceptance,
Okay.
and then let's talk about which policy has more checks and balances. And this is where we'll tell you, please sit down, why we must stop at management. Which policy results in more social acceptance? The moment you say something can be corrected, the literal definition of that and the discursive connotation of that is it is objectively wrong and we need to fix it, right? That's something you have to get behind. You need to fundamentally change these people. Basically, you've marked them and you've branded them as there's something wrong with you, you are defective, right? So suppose saying it's something we'll manage the way we manage everything else in society and make compromises so we can live together. People with anger and rage issues like me should manage it. You know, instead of putting it in that same box, you are putting it in that defective box. There is a problem with you box. You need to be transformed box, right? And how will that lead to more social acceptance for them? The moment you mainstream the idea under the label of science and medicine, please sit down, that this thing can be corrected, you remove the impetus to offer emotional support structures, to offer funding for lighter mechanisms like ours, like management, like funded caregivers and things like that. Because now people go, why don't you just cure it? Why don't you just correct it? Why don't you just medicate that person and get rid of the illness? It gets worse because cures actually don't work, but you normalize the idea that they do. So it erodes the consent of other people and other parents who don't want to opt for these cures. Because now they are met with questions like, why don't you just cure your child, right? They talk about kids internalizing this and falling into depression. Please sit down. Now, you are the ones telling these kids there's something objectively wrong with you that needs to be cured. Versus a parent who says, yes, you may have anger problems. Yes, you may have some of these problems. If the kid can be included in normal classes, then fine. Otherwise, fine. Don't put the kid in a normal class, but you don't have to correct it as well. That child who grows up with emotional support and nurturing is more likely to be happier than a child who's being told you need to treat it, you need to correct it. Here, pop these pills, they make you feel bad, but that's so they can fix your brain, right? That makes the kid feel even worse. The burden should be on society to accept, right? Not on these people to be concerned. Society can accept that. Let's talk about checks and balances, because they have such an optimistic perspective on the medical community and the checks and balances that exist there. Please sit down. The problem is, especially in the field of mentally ill people, there is a huge power asymmetry between the medical community and the patient. It's very hard to establish accountability in this case. While in treatment, if the patient overdoses, in the worst case if the patient dies, the patient experiences so much pain or falls into greater depression, falls into greater rage, it's very hard to hold a doctor accountable. It's very hard to hold. It's very easy to say, oh, we have litigators now and we have medical malpractice lawsuits. Like these are magic pills. Guys, it's easy to establish objectively harmful things that doctors do when you're dealing with quantifiable diseases. Like, you can simulate cancer in rats, right? And you can find out what approaches work, what approaches are objectively wrong. You can't simulate autism in rats. You can't simulate bipolar disorder in rats, right? So it's harder to standardize what approaches are working, what approaches aren't, which gives doctors massive leeway. That's why we're having this debate. That's why it's different from a set of other illnesses that medical malpractice addresses. Especially when you're dealing with people who can't articulate their feelings very well, who can't say they felt so much pain, who can't say they felt abused, they can't say their consent was violated. And doctors have an incentive to keep pushing boundaries in search of this magical cure, in search of profits, in search of all of these things. They have an incentive to keep upping the dosage if it's not working because they are so convinced that a cure will happen. We don't want to allow them that freedom, guys, because we don't think, inherently we think, this cannot be checked, right? It's just impossible to standardize. Besides, there are so many incentives in the medical community and the pharmaceutical community to keep medicalizing things. Like when I was a child, there were very few of these things. Now, apparently, anger management is a theme as well. Apparently, ADHD is a theme. Apparently, OCD is a theme. They make lots of money from this. Obviously, they're invested in insisting that these things can be corrected. We need to countervail against this. We need to move in the direction of acceptance and management as opposed to strictly like reversing and correcting the problem we're having to pose.
Yellow.
Mr. Speaker, at the start of the PM speech, said that the thing that they aim to achieve is social acceptance. But the method in which and the message, underlying message that they want is that they would be perceived or put in the same box as all of us, that they would eventually be the same. But the problem with it is that they must prove that that message is so overwhelming to society and can be that easily accepted just by banning a corrective treatment that suddenly everybody will be able to think that every people with mental illness is fundamentally the same. Because the harsh truth is this, that they are not fundamentally the same as us. The problem is not thinking of them as, the problem isn't thinking of them as different, but thinking of them in a negative light. So it's okay for us to think of them slightly differently from us, but it's not okay for us to think negatively of them in that same way. Right? So the thing that's the first thing out of the way. They must prove that their true very corrective treatment, the message that they send, will suddenly overwhelm society to think that these people should be treated fundamentally the same. We don't think they're able to show that, right? Because now what they do is they apply a similar standard for for people who have mental illness, with people who are fundamental, do not have mental illness and fundamentally sound, right? What you do is you create a different expectation onto them. Like for example, now I must in society a bully who bullies an autistic person. That's something unacceptable. But if you want and aim to put them in the same box, then that suddenly becomes something acceptable because he is at least fundamentally seen as someone similar. We think that's extremely bad. Sit down, right? Now let's move on to the thin difference in characterization of what is corrective treatment and what is not. So see, we really outrightly reject characterization that's shock treatment for overdose of drugs, and towards the half of the first speaker's speech that it involves a huge amount of pain. These are things that we are fundamentally against. Half of the first speaker's speech are things that we reject in characterization, right? So coming to the middle ground, the inherent difference between characterization is this, is that both of us aim to create social acceptance and adaptability within them. The only difference is that we aim to create a better treatment and we aim to eventually help them further adapt to society the same way most normal person is competent at achieving, right? So the inherent difference is that we at least have a certain degree of outcome as opposed to them wanting to keep them in the neutral state that they are, right? So why is this necessarily extremely important, right? Because people with mental illness, as much as they are different from us, some of them have a bit of a dream like us, some of them want to have the chance to reach their full potential as well. Some of them, if given a choice, do want to go through treatment, to be able to be on the same level as the rest of society, to be able to engage and enter society as well. Why is it that are they able, should they deny those people the opportunity and the choice to go through those corrective treatment? That's what they need to engage with. So people with autism can sometimes be brilliant, but they are often not taken for granted because they are inability to adapt to society, inability to cope with society. But they are given a chance to go through corrective training, which have been proven to work. For some autistic people have been able to join common schools. Therefore, then they are able to fully realize their full potential. We don't think that this is something that you should deny them of as well. Sit down, right? Now, furthermore, let's talk about family and how this affects family generally, right? Because as much as parents may love their children and they're able to deal with a lot of things that happen, it may be sometimes overwhelming, but they're unable to cope with the unpredictability and the violent tendencies that these people have. While management is good, by correcting or helping them actually deal with those violent tendencies are things that are more fundamental and things that are important towards those people. That's why treatment and corrective treatment are things that are extremely important. So this, the inability of a parent to deal with the lack of response from their mentally ill children will largely create resentment between the parents as well as their children. Yeah. Having having hope, or having a little bit of correction, or helping them adapt further into society is something that's extremely fundamental to its family members as well. Right? These are things like that. This creates protection towards both the family members as well as the people mentally ill people as well. Those things like finger sit-ups. But more importantly is this, right? What about development and are we given up of people who are mentally ill? Because society, the harsh truth is, society revolves around us and not around them, right? We hope that society will be able to adapt instead of them adapting to us. But the harsh truth is society won't operate that way. So therefore, we need to eventually develop more treatments for people who are mentally ill and be able to help them, Because in the past, if we had treatment like shock treatments and things like that, we have moved past all those things and be able to create more effective treatment currently. Now, a lot of the treatment has been largely moving towards psychological treatment rather than treatment that focuses on pain in the past. So the fundamental idea is this, is that treatment and research only have an incentive to grow the moment you don't ban it and allow them to continuously flourish. So we don't think that at this point that there are still some mentally ill people who to integrate into society the same way we do. We shouldn't deny them the choice as well. Yes?
Ma'am, can you give me an example of a mental illness that is treated with a drug that has no major side effects or won't require assistance from the patient?
I don't want to debate of examples, right? But really, the idea is this, right? These people with mental patients are able to adapt within society, but they need a little bit of help, and we don't think that it's time that we give up on them. What corrective treatment aims to do is help them manage within society, and as well as help a potential aim to help them eventually fully adapt to society and maximize their full capacity. Right? We think it's unfair that we deny them that same opportunity and think that they want to forever be in a neutral state. They want to forever be unable to adapt within society. We don't think that limiting them and just thinking that there are simple things that they can just manage is necessarily more harmful towards them in the first place. They're not people we want to manage, they're also people who aim to enter society the same way we all manage to enter society. Right? We shouldn't deny them that opportunity. We're proud of it.
Next speaker for speech by the last speaker of the constructive round from side government.
It is not a choice when you mainstreamize the idea that there is a cure towards your mental illness, which is often an illusion, which is perpetuated by pharmaceutical companies around the world to expand their profit margin. It is not a choice in this debate, because I am forced to take that medication under the hope and presumption that it will cure me, although the vast majority of cases it does not, it makes my situation worse. It's not a choice for parents to do so, because if parents choose to opt out from that system, they are seen as irresponsible actors who should be punished, support structures removed from it. It is not a choice. The point in which you force these individuals to internalize the kind of sickness in which he deems to be appropriate, you are making the situation worse. Let's be clear what this debate is really about. Obviously, you can't expect government to say that we will allow you to be on the streets. What we want is management, not the complete alteration of your identity. I want to ask opposition a question. If they consider journalists as just putting this mentally insane person in a confined area as a form of debate, then it becomes unfair, ladies and gentlemen, because if you put a person in a confined area, how do you change his identity? He's still mentally insane. You need to defend the kinds of heavy medications you place upon the person, regardless of if it's invasive or non-invasive, because you want to significantly change his identity and not manage it. 3 questions: suffering, acceptance, and pursuit for cure. 1. Suffering. So the accusers, well guys, you are also altering it. 2 responses. Number 1, that alteration is for management. That's why we're using the similar common medication introduced upon other people. We think that's sufficient. We had no response from the second speaker to Shamila's response. Secondly, this is the most critical difference, right? Management is for self-preservation. Obviously, you don't expect the state to allow a mentally insane person to cut himself or to go on the street and take a gun and shoot you because he does not know about his action. That's why it's for self-preservation. Under your policies, you no longer for self-preservation. You no longer want to contain that person. You want to change that person's identity because you think that it's curable. We think those are the 2 principal distinctions in which that side must feel. We think it's a shame that they did not. So why is suffering made worse? First speaker's argument was, well guys, these people want help. Often if you don't give them help, they become suicidal. 3 responses. Number 1, first, for hardcore actors who are genuinely insane, because the presumption they want help, these people cannot consent. For the hardcore actors who are diagnosed to be mentally insane, often their actions cannot even be taken into consideration. That's why they commit a crime. It's not considered to be a crime because rationality is not there. So a substantial portion of the case missed out one of the critical characterizations we talked about. Sit down. But for these people who cannot consent, they are happy. They live like a free, happy life. They don't know what's going on. They've been taken care of by a caretaker and all those kind of things. It's a stress-free life. Under your policy, you are bringing continuous daily pain upon the person because pain is the objective criteria which every human being can face, regardless of their mental stability. You are hurting that person. But secondly, let's do their characterization. What about benign actors, right? Benign actors are also coerced to take it because now, once you mainstreamize the idea that yes, I'm insane, and there's a pill out there which I need to take, there's a treatment out there which I need to take, therefore I will take it, ladies and gentlemen, because I'll see myself as being someone who's diseased and there's a cure out there to treat myself. Therefore, it's no longer a choice when you mainstream the idea, when society pressures you to take it, because if you don't, that means you are bringing a lot of pain to society economically and in a lot of other ways. It does. But thirdly, if you really want to help them, you're not helping them when you internalize the pain of the person by saying, yes, I'm actually diseased. Yes, I actually do have a problem. You don't help that person, ladies and gentlemen, because I'm forced to internalize the pain which I feel. Now, your policy makes the situation worse. Once I'm a patient, I'm good, I can do something about it. You incentivize me to overdose it. When I take the first batch of pills, it does not work. Maybe, but for these other persons, for these other people, it did work. I won't overdose it. Unfortunately, if you look at mentally insane, there's no standardized criteria. Different people have different standards of mental insanity. It's not like, okay, you take 2 pills, I take 2 pills. If I know that person works, I'll take pills continuously until often they won't get healed, but they'll die as a consequence of this overconsumption. Sit down. As a consequence, ladies and gentlemen, suffering is ours. Acceptance. I want to deal with this, right? Under status quo, there will still be people who want to opt out from this treatment. But once you mainstreamize this idea, it becomes impossible for them to opt out. Their response was, well guys, the problem is that we should not treat them negatively. Under your policy, the point in which society sees that, hey, there is a cure out there, but these people do not want to take it. Now society will think that these patients are irresponsible. There's a possibility they can be cured, but they make the intention to not be cured, ladies and gentlemen, that they are wasting our time, our money, and they're making irresponsible action. Therefore, you open up the room to discrimination. You remove social support structures, ladies and gentlemen, like funding for the management which we want. Because why should we fund for your management? It's expensive if we can just go give you pills. We think that's particularly problematic when you pay these people as individuals who are irresponsible. On family members, right? Family members will also be coerced because if not, they are seen as irresponsible actors. Their response was, well guys, at least we can help parents. Keep in mind, this is not help parents manage. This is help parents change the identity of their kids. Because parents, usually, like imagine you know that there's a magic pill out there. As a parent, you will force your kid to down the pill day after day and day. Since it's not standardized, you do not know how much you need to give, you make situations worse. The point in which parents do parents to give the pill, and they still choose, maybe to some people, to not give the pill. You push parents to the corner of desperation, you don't know what to do, you make the situation worse.
My inability to compute my emotions as an autistic person, and I'm acutely aware of how depressed and the pain I feel from suicidal injection, why you allow these individuals, who are the majority of cases they are aware, to not have the possibility of
Unfortunately, when you look at mentally insane individuals, it is unbelievably difficult for you to gauge the amount of treatment and dosage which you need to give, because different people have different forms of mental sanities. Weekly visits is insufficient, ladies and gentlemen, and becomes worse when doctors see silence as a form of acceptance. Hey, maybe they're not feeling pain. But if you look at people who are autistic, I have a cousin who's autistic. When he was given the treatment, he was very silent, and more treatments were given until a form that was debilitated permanently, ladies and gentlemen. We think that is damaging. Finally, pursue for a cure. If you really want to pursue a cure, and you push these individuals to continuous experimentation, battering rams, when doctors have a perverse incentive to continuously give crazy medications under the hope that this will be good for society. No response on how pharmaceutical companies have a perverse incentive to expand their profit margin. But even now, like if you look, in 2009 there was a push for OCD to be considered as a form of a disease. ADHD is considered to be a form of disease. You internalize insanity, which is false, ladies and gentlemen, for pharmaceutical companies to reap benefits. We had no response whatsoever from that speaker. I am absolutely proud.
And to stay on my speech, but last year, constructive now the opposition.
To assess the debate, we look into three issues. Firstly, we'll assess mentally ill patients. Second, we'll look into family members. And lastly, the ultimate objective is debate on societal acceptance. Let's not forget this, ladies and gentlemen. And in the end, the objective that the burden the government took is to ensure that there will be societal acceptance. But let's think about it through. If the only thing they want to do is to manage them and to never, where is that link on to constantly drugging them or to constantly manage them only will then lead to a better societal acceptance? How this mentally ill patient will suddenly communicate better, will suddenly make better decisions, will suddenly treat people better and not harm them in their skin. So if the only thing you're doing is to drug them. And let's be clear that in the end, we want them to be better because in the end, mentally ill is a sickness that they also conceive. But the question is, how do you manage them? Let's go to the first issue, ladies and gentlemen, in terms of mentally ill. The comparison between the two policies is that they argue to you that's only to manage. And on our part, it's not to correct them. You see, let's be clear that even management or even drugging them are not mutually exclusive. We are also doing that under our paradigm. But the difference between what they're doing and what we're doing, but they seem to think that if we are correcting them, we have to strap them, we have to shock them. Those things are things that we're not willing to defend. After all, this status quo, when it comes to corrective treatment, there are so many things that you're doing. That includes the drugs that we're talking about, includes teaching them skills, includes better care, support, and better relationship with family members. Therefore, Mr. Speaker, in the end, there is a sunset on our part. And this is what you need to remember. Their part, on their policy, is only to manage them, and we don't think there will ever be any ending to this patient. And the problem with them, that there never be any ending, is that the patient will always be dependable on the support that they get from the family members. Let's not forget, the family members are the closest to me, but the moment they lose the family members, the society will never accept them. But in the end, the societal acceptance, right now, is only dependable on the family members who want to manage them until the end of their lives, and also correcting them. So at least in our policy, there is a possibility that you're able to cure them this matter. But even then, Mr. Speaker, that is a matter of dealing with the harms that come up from mentally ill patients. And on that side, they argue to you that these are schedulers who will then harm people of modality to things that are beyond what they can do. Schizophrenia, for example. But how much drugging them probably will lead to this movement of brain at that point in time. But that will also mean that you have to drug them a lot further and further to certain drugs. That the way that you deal with drugs is that soon enough you will be less immune to that drug, and therefore, even for you to only manage that, you have to constantly increasing the amount of prescription of the drug, the capacity of the drug, intensity of the drug, so that you'll be able to hold it for a longer time. In comparison to our side, the drug is only implemented when they are going to do the harms. But the possibility is that you will be able to cure them, and therefore it is a lot better on our paradigm that they ensure there is a possibility to that end, as opposed to only managing them that are dependable on the drug constantly being increasing in terms of capacity, and second, constantly dependable on the family members only always be there. We think in the end, Mr. Speaker, that they are never dealing with the part when this child are being depressed or being attacked by other people. If you're only going to put them into that drug state, because in the end, when people perceive them, it's just like any drug addict, or just like a drug patient who probably is less harmful, but it's still the same person that they were before, and never a different mentally ill patient. Before I go to the second issue, go.
If you agree that the amount of dosages is bad, under which policy would require more dosages? A policy which only want to manage them, or policy which would like to radically cure them?
The difference is your management will be throughout the life of that patient as long as they survive. That means the drug prescription will constantly increase because it will be a longer time, as opposed to only using it at the point where you need to use it because they become a different person, and at the same time trying to come up with a way to ensure that the corrective treatment they will never be that person that they will when they're mentally ill. Let's go to the second part on family members. The altitude is that there will be a blame game because it's measurable now. Because the moment they know that they are going through a cure, to a treatment, then they will blame the doctors that treatment will never cease to achieve. We think as opposed to that, we think at least that possibility exists. But let's compare and contrast. Under that part of the debate, they were always depending on their management only. And that resentment, like we told you earlier, will be dependable on how that drug will be good enough or not. But on our part, Mr. Speaker, we think that resentment is a lot better. Because at least family members sees an end to that. Though it's measurable, though it takes longer time, but they know for a fact that there is an end to it. As opposed to knowing that this person will burden me for the rest of my life, and the drugs will constantly increase, and therefore it's a lot harder for them to speak up. So resentment is that the resentment is higher in their paradigm, because they know for a fact that you have to take care of this person for the rest of their life, as opposed to knowing that there is something better. But let's compare this figure as well. We don't know how they treat doctors. So they argue to you that doctors are less accountable because doctors then will push the boundaries to tell the family members that they'll be able to cure. But let's not forget that any other doctors are bound by Hippocratic oath, and therefore they will want to put boundaries to ensure that the patient will be cured. But again, it's a moot point. Because on the that side of the house, the doctors will still be accountable to the possibilities of putting too much drug on the patient. They will feel a lot more better if they're not going to do something stupid when they are still ill. As opposed to that, in the end, it's about having the possibility. I think family members will see an end to that and therefore work more harder to ensure that the end will be better. Lastly, the support structure. The support structure on our part is more holistic. As opposed to only managing it, as opposed to only ensuring that this person will not go beyond what they were doing by drugging them, we see a more support structure. Because they know for a fact that there's something better to that end, so they will work together towards that end, and to ensure that the person will be better. Lastly, societal acceptance. This is their biggest burden. They told you, under that paradigm, the moment you keep drugging them, then the label will be different. We don't think so. If on our paradigm they accuse that these people will perceive this patient as someone that has to be cured, but under that paradigm, people will perceive that patient as someone that has to be drugged. Therefore, it's the same thing. The label will not change. But how does that label change? It's a matter of understanding how society perceives a sick person. So if you want to make these patients as a normal person by only drugging them, this is what you take with the sympathy. It's understanding the society, the way, because there is different people in society. There are bullies, there are people who understand. For bullies especially, the more you treat them as normal, when they are yet to reach their maximum capacity and potential, this one society puts a higher expectation of these people. So when they can't deal with society, when they can communicate well, but they're supposed to be normal to society, that's when you put them to a lot of harm and all the bullies and all the repression from society based government. But now what? We see the end to it. So when society realize that these are different people, that's what society will treat them differently. That's exactly what Semifinals was happening. We give them a closer parking to the entrance of shopping mall, so that it will be easier for them. So they're not yet to be. But in the end, it's about society accepting them that they're different and treating them a lot better, as opposed to putting a higher expectation on these patients. For all these reasons,
Thank the speaker for his speech. We now move on to the replies, starting with side opposition.
Ladies and gentlemen, do you know who loves the management-only argument? Pfizer loves that argument. GlaxoSmithKline loves that argument. That's because they keep parents and families in perpetually on the line of having to use prescription drugs to keep them in management. To not have an end goal, to not have a sunset of which a cure will be possible, where you will not be able to need to be sedated by drugs day by day and have to be choking down pills every single night, ladies and gentlemen. That's the kind of perverse incentive that you have under the sub-government if you tell individuals and you tell society that you can keep taking drugs and it's okay for you to be that way because we don't want to help you get better, ladies and gentlemen. We think that drug prescription is so much worse under the side of government. What am I going to talk to you about in my reply speech? Firstly, I'll look at parents and what kind of expectation that they have towards their children in regards to how they care for their children, ladies and gentlemen. Secondly, I'll talk about expectations in general, because by far and large, we can prove to you that the single biggest burden on the side of government in regards to social acceptance will never be attained. But lastly, something that they never wanted to engage with. The fact that individuals in society that are acutely aware of how they are perceived by other members in society, that they are aware that they have Down syndrome, but they are depressed at the fact they are unable to do anything about it, ladies and gentlemen, and how this policy severely victimizes these individuals. Firstly, let's talk about parents. We think it was very simple for them to say that parents will be very happy now that there is no end goal because now I don't have to rush towards that cure. But the funny thing here is, if I can find a cure and say that, hey, if I take this operation, my Down syndrome will be over, they'll give my parents a large incentive to say that I'll take that cure over the kind of drugs that I have to force down my struggling child every single day. But in comparison on that side of the house, the kind of resentment that parents have over their kids, the kind of choking down large amount of pills on kids happens when parents cannot foresee an end to this sort of burden that they perceive as imposed upon them. That the fact they have to care for their child for the rest of their lives and there's no expectation of any sort of way for them to get alleviated from that. The fact that when your child is 60 years old and you're 80, you still have to put a diaper on it and choke down 40 pills a day onto this individual. In which side of the house do parents have to be more resentful or choke down more pills to compensate? Because now they know there's not a cure. So how do I compensate? I make them eat more pills, ladies and gentlemen, to compensate for that situation. We think at the end of the day, parents are oftentimes looking for the hope that they may be able to fix or be able to cure their child. They're extremely benevolent when there is hope. But when they turn desperate, we think that oftentimes the harms that they talk about parents turn out to be on that side of the house. Secondly, let's talk about expectations and how do we manage it, ladies and gentlemen. The reason why we told you from very early on was society is able to be sympathetic towards the individuals that have mental illness is because there is a measurable expectation that they are different. That is okay for them to be different, but it's not okay for us to mistreat them, ladies and gentlemen. In that instance, we recognize there are fundamental differences in what they are. But that only occurs when there is a measurable expectation of whether a cure can be found and what management is, ladies and gentlemen. But when you take that away and remove any sort of end goal from the equation or any expectation of an end goal, What does society do? How do I measure this individual that comes to apply for a job for me when it comes to me having to employ an individual with a mental illness? I have no other metric to measure this individual but two ways. Either I measure him as a normal person or I measure him with a discriminatory attitude in his gender. Everything on both accounts in an unrealistic, unreasonable expectation for an individual that has mental illness to function in that regard. You can talk about support from parents anytime you want, but once those parents are dead and gone, we think that society is going to be very much less forgiving at the end of the day. Lastly, ladies and gentlemen, an individual's inability to compute emotions, an inability to rationalize the extremities of your existence, or your inability to manage how you feel in regards to how society treats you, and you being acutely aware of that, it's not a social construct. It's not what society tells you. It's what you feel when you know you could be something more, but people won't let you. Thank you.
Thank the speaker for his speech. Last speaker. Wait, must be covered. Yeah.
Ladies and gentlemen, what happened in this debate is we had an opposition team that was accusing us of being soft because they wanted an excuse to be soft. And there were any trade-offs, they were just too afraid to defend. So let's go through them. Number one, what are the probabilities during the corrective process? In the greater majority of cases, because that's how debates are won, not by proving 1 in a million chances, but in the greater majority of cases, what is likely to happen when we try to cure people? We were very clear. A cure cannot be found. It is very likely you are not going to find a cure. If you find a cure for 1 in a million, that cure is probably not applicable to the rest of your sample, right? Because it's hard to standardize these things. All the benefits that came out in the third speech and the reply are contingent on you finding that cure. If it was so easy to find the cure, guys, we wouldn't even be having this debate. They seem to act like, oh, it's a standard cold or fever. It's not like that. It's hard to find that cure, right? And we're not willing to take the risk. Because in that process of searching, so many other people get screwed over. And we talked to you about how specifically, right? We talked to you about how difficult these drugs are, what the psychological, physical effects on the person are. We talked to you about the lack of accountability of doctors and pharma, how there are no fixed standards for dosage. I mean, it's quite easy when you're managing someone, right? The moment they fall asleep, you stop giving them medicine. The moment they stop being violent, you stop administering the medicine. But when someone is insane and you're trying to change them, you don't know where you stop, right? So they can't just try to wash all of that and pretend it's the same. You don't know how the patient is feeling because it's hard to gauge responses from the patient when you're treating them. So yeah, Big Pharma makes money off sleeping pills and mild antidepressants, but these things are cheap. Cures are probably going to be really expensive. Cures are probably going to be like major lifetime equipment. We don't buy the very late response in the reply speech. Let's talk about a bit more about the nature of the treatment and the nature of the correction, right? Because this is not just any other illness, as we've said. We've talked about heavy education, we've talked about some degree of coercion that has to be involved if the patient resists, because they're uncomfortable, because they're nauseous, because there are serious side effects, because they don't feel like themselves, which is how a lot of bipolar people react. They don't respond to this. And we ask them, it's quite telling. We go, can you give us an example of a medical treatment that was cured by like a simple short process where you just had some counseling and a few non-invasive pills, no operation, no surgery, no non-restraints. They couldn't give us an example because the entire case is premised on shoddy science. But I think where this debate really turns, setting aside all that softness and evasion, is the erosion of choice. It's ironic that they go, these are people who are choosing to have a better life. But in their second speech, they betray their true intentions and they go, whether we like it or not, society revolves around us, not them, and they therefore have to adjust to us. Which is actually an admission that this is about bullying people into being like us, right? So we engaged both demographics. We said, and then they just kept trying to muddle it. The demographic that can somehow make a choice, can somehow articulate a choice. We think that choice is still forced upon that demographic because they're being told something is wrong with them, and if it doesn't change, it's not because it's not their fault, right? It is because they recklessly chose not to opt for the cure. And that's where the labeling comes in. Sure, both of us are labeling them as needing of intervention. But we are saying it's not your fault. You don't need to be changed. We can just manage this. You guys are saying there's something objectively wrong with you. We need to change you. So even for those who choose, that is a false choice. That is a choice that's internalized, and that is an erosion of their choice because other support structures are taken away. They're happy to see that it's second. I mean, apparently the world revolves around the non-mentally ill. But what about the demographic that cannot choose, right? The people who can't make these choices. That part, they just conveniently ignored in the debate. But they were happy to tell us we won't be able to manage them. Somehow we can't be able to manage them, but they can make a choice to accept a cure. That's just a bit counterintuitive and a bit unfair of us to buy in this debate. We are proud to support.